What is a deductible? When it comes to health insurance, a deductible is typically the amount of money you must pay each year before your health insurance plan starts to pay for your covered medical expenses. Here's how your deductible would work with a sample health insurance plan. This sample plan has a $1,000 annual deductible, 20% coinsurance after deductible, and a $2,000 out-of-pocket limit on your coverage. If you suddenly had a $10,000 medical bill, you would be responsible for paying all of the first $1,000 in covered expenses. That's your deductible. After this $1,000 deductible is met, the insurance company will pay a percentage of the bill and you will pay coinsurance. Be aware that co-payments typically do not count towards your deductible. What is coinsurance? Typically, coinsurance is a cost-sharing requirement some plans have where you are responsible for paying a percentage of a covered medical expense while the insurance company pays the remaining percentage. This is usually after your deductible is met. Here's how coinsurance would work with a sample health insurance plan, which has a $1,000 annual deductible, 20% coinsurance after deductible, and a $2,000 out-of-pocket limit on your coverage. So imagine you suddenly had $10,000 in unexpected covered medical costs. With this sample plan, for your first $6,000 in covered medical expenses, you would pay the first $1,000 yourself to meet your deductible. Then, for the next $5,000 in covered medical expenses, with 20% coinsurance, your insurance company would pay 80% of your covered costs, $4,000 in this case, and you would pay the remaining 20%, or $1,000 in this example. With this $10,000 bill for covered medical expenses, using this sample health insurance plan, once you've paid the $1,000 deductible and $1,000 in coinsurance, you've reached the sample plan's $2,000 yearly out-of-pocket limit. Be aware that co-payments typically do not count towards your deductible or coinsurance. What is an out-of-pocket limit? Typically, the out-of-pocket limit is the maximum amount you will pay out of your own pocket for covered medical expenses in a given year. Imagine you suddenly had $10,000 in unexpected covered medical costs. For this sample plan, which has a $2,000 out-of-pocket limit, you would pay the $1,000 deductible and $1,000 in coinsurance, while the insurance company covers the remaining $8,000 of this unexpected bill. With this sample plan, even if you were hospitalized again in the same year, the insurance company would pay 100% of your covered expenses because you have already reached the sample plan's $2,000 yearly out-of-pocket limit. Be aware that co-payments typically do not count towards your deductible, coinsurance, or out-of-pocket limit.